seems to be fair.
So hello again. We're going to move on to the next second part of our series, which is going to be working through the legs. Hopefully the film is going to be slightly better than last time, because I realised that most of the time I was actually blocking what I was doing. But anyway, I still think you could manage to understand what you needed to do. So we finished by working through the feet, and then we had finished just by doing some palm presses up the legs to start to warm up the sen lines, which I think I had explained to you previously. The sen lines are the energetic lines that run throughout the body. There are specific lines. They're similar in the sense to Chinese meridians, but they're not the same channels. But they're similar in the way that it's an energetic flow, and by working on them, creating compression, you get the flow of energy to go through. If there's any blockage or stagnation, you liberate that and create more balance and harmony throughout the body. You can also access specific points if you want to. But for the first approach, for a beginner's approach, you don't need to be too focused on the specific lines where they are exactly. So long as you know globally where they run, you will already start to be create some movement through them. It's not like acupuncture that you have to know the precise point of any particular given point, because we're working more with a sense of pressure, which is it's more general basically. So we always start by warming up the lines, and we do this by working on the soft tissue, the interior part of the legs first. 3 lines that run up the interior face of the leg, and 3 that run up the external face of the leg. So again, rocking from side to side, that cat-like movement when you get to the knees. You can do 3 rotations just to warm up the joint there, loosen up the patella, and back down. Always working with your body weight, if possible with a straight back, so that the energy is flowing through you as well. You can also do some warming up of the tissue by doing more global presses. So by taking the heel with one hand, swapping over, making a bend, you can do work by using your whole body into the tissue. Coming up a bit higher, and again, sink back into the musculature, the adductors, making sure that you're not on the knee joint. Again, lifting up. Also do this from the outside. And it's a gentle sinking in of your weight into the tissue of the leg. Then we can come into some more specific line work, and the technique that we use for the line work is that thumb on thumb, chasing thumb on thumb up the lines. So you've got 3 lines on the interior face, starting at the medial malleoli, running up to the knee, patella, and then coming up the length of the thigh, then slightly more posterior, running up more where the soft tissue of the calf is, coming up the internal face of the thigh, and then the last one is more posterior. And you can take as little or as much time as you want working those. But the important thing is to sort of settle into a rhythm. So whether you decide to do them quickly or if you decide to really spend a lot of focus, keep the same rhythm and the same spacing between, because that helps your client sort of settle into a sort of deeper state of relaxation, because it's almost as if the body knows what's coming, so it can just relax and receive. So you use your body weight, open stance, and the pads of your thumbs to work up the line. And it's really that rocking from one side to another, shifting your weight and using the whole of your weight, arms straight. When you get to the knee, you skip the knee and start on the other side, traveling up the leg. Once you get to the top, you can travel back down the next line, which is slightly posterior to it. Don't worry too much about the specific localization of them. Even if you just run 3 parallel lines up and down, your client or friend will feel the benefit of it. And then up again. Normally I would probably spend more time doing this, but for the sake of this video, I'm just kind of speeding it up slightly. And then again, palm pressing down, and you have a slight rotation of the leg, keeping on the soft tissue, to the middle, and we can go back up out. And a little bit of rotation through into the hip joint, loosening the articulation, creating a bit of mobility. And then it's the same procedure for the external lines. So your first line will be anterior to the malleolus, coming up to the knee and then traveling up. The second line, the middle line, is pretty much where, if you were wearing some tight jeans, you would have the seam. So completely medial. And then the last line on the other side of the lateral malleoli, just starting in that little dip, following a little bit more posterior to the top. I'm going to do it on this side so you have a bit of better view. And it's the same thing. We start by palm pressing for the lateral lines. You create some internal rotation of the leg when you palm press. And again, that rhythmic rocking, which when you're not talking and you're a little bit more focused, you can sink into a meditative state when you're doing it. And again, we start at the bottom, work up, just lateral to the spine of the tibia, the crest of the tibia, far as the knee, the patella, skip over and travelling up to the top. And then we can come down the middle line. Thumb following thumb, sinking into the tissue, skipping over the knee joint. And you're going to finish more or less at the top of the ankle, the malleoli. And then the last line, more posterior, closer to the floor, traveling up. And once you've done the 3 lines again, palm pressing, keeping your back straight, shoulders dropped, neck loose, just sinking in with a gentle rhythm. And again, you can shake that off a little bit, create a little bit of movement. It's not particularly traditional Thai massage to have this rocking sort of sensation, but I think it's very effective and helps ease the client. And then we start with a bit of mobility, working through to the hip joint. And to do that, we lift the leg up, lift the knee. I always try to support the knee as much as possible, simply because knees are very vulnerable joints in the body, and if the person has any issues, which of course you should ask at the beginning if they've got any particular problems, any medical history that you should know about, the knee is one of the joints which you don't want to create a lot of torque on, because it can put a lot of strain on the meniscus and create problems. So by supporting the knee and just having your hand underneath the heel, you can just create some movement through that joint. And you really do it using your whole body. It's not that I'm using my hands like this, but the motion comes from the floor ultimately, because that's where I'm making contact, but also from using my whole body and creating, if you like, anchor points with my body. So once you've mobilized that joint up a bit, explored its range, seen where there's stiffness, see where there's lack of movement, and even see where there's holding, because often you'll find a client may have free mobility through their joint, but they don't have free mobility with their mind or their emotions, so they can't let go. They're in a state in which they can't release their body and give it up to someone else, really. So that's something to play with, and it's also, to a certain extent, a learnt response, because people who haven't received a lot of body work are sometimes a little bit apprehensive and not ready just to let go to someone they don't know, which is fair enough. So once we've worked that a bit, we start to open up the joint to the side. Might need to move the person's hand. And likewise, I always try and support the knee as much as possible. So to begin with, we're just opening up, palm pressing down the other thigh, supporting the knee into your hip here, and you'll see my hand has made a fixed point with my knee here, so even if the person's big and heavy, it's not tiring for you. You can support that because it's not with muscle strength that you're supporting them. Then we can come down a little bit. Depending on the person's flexibility, you might want to fix their leg with your other leg here at the bottom, and that way you create a fixed point down there, which will deepen the stretch. And again, sinking into that tissue. And it's also, you're carrying on with the sen lines, you're carrying on working into those sen lines, but just in a different angle, different approach. And that's one of the things I love about Thai work, is that we come back to the same points, the same lines, again and again, but from a different perspective. So it's not like some massage that you might have experienced on a table, that once the leg's done, it's goodbye and the legs aren't seen again. With Thai, we come back to each body part again and again, and the work becomes deeper and deeper. So once we've worn that up a little bit, we can release the foot down. For some people, support, if they haven't got a big range of movement, I might support them with pillows, cushions. Other people, I might just let their leg drop out. It's kind of what you feel is right, and what the approach you want to take is. And we continue to warm those lines up. So again, coming from a straight back if possible, arms straight so the weight of your body can sink through, and you're just warming that tissue up again. And you can also create a counter force with your knee if you want. If the person's got a lot of flexibility, you might want to create a bigger range of movement through there. And then for the next part, we come into a seated position. Place our feet on the bottom of the thigh. At this point, I normally lift the cushions out. This other hand gently at the ankle. And just by straightening our legs, we start to do this sort of kneading in to the sen lines, activating them, feeling the movement of energy through them. And this work can be very deep, and you have to really play just with the range of motion and movement that the person has to see how far an angle you might work at, and that just really depends on the flexibility of each individual. And then we can hook the leg over like this, and we can just do some work, just releasing our hands just with the feet. Hook both in the leg over both feet, and you can create a little bit more of a tension through. We can finish, we come a bit closer, and you have a sort of wrapping muscles over your feet. Again, working the sen lines on the other side. Then bringing the knee up into an upright position, shifting your weight, and creating a fixed point with the foot with the base of your knees where you're kneeling. And now we're going to be working the sen lines on either side of the thigh. And you can either do this with point work, where you just bring your elbows together and you work down the sen lines like that, or you can use the base of your palms and do this with squeezing. Again, the movement comes by bringing your elbows down, so it should be less tiring than if you were just like using your force with your hands. And again, if you can, do the work in relation to your breath. And I would normally do this 3 times on the whole. A rhythm of 3 is maintained with Thai work, at least when I do it. I don't know about other people. And then we're going to work I'll just lift Matthias's leg up for a minute. We're going to work the line that's down the center of the posterior part of the thigh, and we're going to do it with thumb over thumb, on points all the way down there. But we actually do that in the same position, but just so you can see. So it's that sort of gesture with your hands. You're going to be sinking into the tissue in a line down to the ischial tuberosity, which is that little bone that you sit on at the base of your leg. And again, I would do 3 passes. And this, the movement is also coming through your body. It's not the force of your fingers or your thumbs. You're sinking in using the whole weight of your body. And we can do some twisting of the thigh. So we're going to wrap this hand and we're going to have a rotation round, then the other one, and we're going to travel down the thigh like that. And this also works to lift the tissue, removing any adhesions. Then we come into the calf muscle, the gastrocnemius, and we just give it a general massage through the flesh of it, pulling the tissue away from the bone, massaging it gently down towards the heel, towards the Achilles tendon. And once we've warmed that up, massage through it, we're going to work down the sen line, which is in the center. We're going to do the same sort of thing as we did on the posterior part of the thigh, but we're going to interlace our fingers like that and just work the points all the way down there. And as you do so, it's just a matter of leaning back, sinking into the tissue, coming forward, changing your placement, and leaning back, sinking in, leaning back, coming forward, sinking in, leaning back, all the while traveling closer and closer to the heel. And again, we can finish off just by gentle massage of all the tissue. Then we're going to do a little bit of stretching work, lifting up the knee with one hand, picking up the heel with the other, and you just cradle again the foot into the plie of your hip. Again, you can create a fixed point with your other foot like that, supporting the knee with your hand so we keep this in alignment, we don't end up creating torque. You've got, I've got my thigh also supporting Matthias's lower leg, and depending on how flexible the person is, you're going to have to either open your stance more or close it to create more of a stretch and range. And normally the stretches, again, it's in a rhythm of 3. I try and work with the person's breath, so I normally would ask them to inhale, and on the exhalation I would sink into the stretch. And the first time it's just like an introduction. It's just like seeing where their range of movement is, how far do they comfortably go. You release it and then you go a little bit deeper into the stretch, and for the final one you extend to where you feel is their full point without creating extreme pain, which if you have a massage in Thailand, that they're quite yang in their approach. They often take you right to your barrier and beyond, which is a way of working, but it's not my way of working. So, inhale in, Matthias, and exhale, sinking in. Inhale, exhale, inhale, exhale. And you can also take this stretch this side if you want. But if you do, make sure you're supporting the knee. Back, coming back down to a sitting position, bringing the leg back up, and now do some stretching using our leg like this. So you just place your leg initially just underneath the popliteal crease, the flexion point of the articulation of the knee, and by creating a little bit of pressure this way and gently pulling, leaning back, or not, just leaning back, you don't need to pull. You create stretch and then shift the weight again, and shift the weight again. And we can finish off coming down towards the attachments of the hamstrings and sinking in. And then we can do a little bit of work towards the other side just to finish off. Releasing the leg out and just bringing it down. So everything that I've done on this side, you would then do on the other side, and that would be the bulk of the leg work. And afterwards we could come into some more specific stretching using the 2 legs at the same time, but we'll leave that for the following session, which will incorporate some of those more global stretches along with the stomach work and the chest work. So I hope you enjoyed, practice that, and hopefully not too many days will pass before I manage to upload the next part. But even so, you've got legs and feet to practice, and practice it enough so you don't have to be thinking about what you're doing, and then you can really get into the feeling of the work. Okay, thank you.